So as a clinician, just to go back, so that you mentioned, the toxic burden, right? The synthetic estrogens in our environment, which are so ubiquitous in couches and flame retardants everywhere, brominated compounds. But I'm interested because you picked that first out of all the factors. So as a clinician, you feel that that's a big issue, you find?
Yeah, I think it is. I guess I used to do a lot of obstetrics, and I used to lecture to medical students and residents about neurotoxins that we measure in cord blood and in breast milk. And when I first started lecturing, it was around 200, and then next thing I know, it's like 374.
Yeah.
So in Canada and in the U.S., there's a lot of biomonitoring about toxins. So it's not something that the naturopathic clinic made up or whatnot. It's a true environmental issue. And what I've learned is I actually have genetics in my detoxification.
Wow.
And so I actually am missing glutathione S-transferase or GSTT1. So I don't detoxify well, and so a lot of people can take NAC and make glutathione, and I had elevated mercury levels and took NAC for years thinking I'm doing this wonderful job in detoxifying, and lo and behold, I did my genetic testing and found that I was missing this enzyme, and I started taking glutathione, and then all of a sudden my weight was easier to manage, and I started feeling a whole bit better, and then it kind of made me think, gee, I think that, one is we're exposed to a lot of toxins, and then I see a lot of clients who aren't feeling well, and I'm done everything already, and like what am I missing?
Yeah.
And then when I kind of add in that detox pathway, how do we upregulate it, make it more efficient, people start feeling better, and weight actually was improved. So,
wow.
I always laugh that a lot of my patients, they come in for kind of the wellness or hormone, and they're kind of concerned about the fees they have to pay. But anytime that I talk about weight loss, it's like, sign me up. I don't care how much it costs.
Mm-hmm.
But, so through our weight loss program, we sort of address all those lifestyle, nutrition, supplements, and, it's a great weight loss program. But on top of that, we always talk about detoxification and hormonal balance.
That's huge. And so if we could take a deep dive into what you recommend, so NAC and sulforaphane, probably other B vitamins and so on, but you also have saunas here as well. So was that part of your therapy too, sauna
So
therapy?
again, because the clinic is, fairly new, but yes, so we want to incorporate the detox saunas as part of it, because again, actually just to step back again, is that what we've seen is a lot of people, when they start losing weight, their CRP starts elevating. And my theory on that is that we're liberating a lot of toxins. And again, if those detox pathways aren't open or we're not getting them out, all we're doing is recirculating these toxins and basically self-sabotage, because what does the body do? It says, oh, I need more fat to neutralize these toxins, and tell you to eat. So if we work on getting those toxins out, so through supplement or infrared saunas, exercise, whatnot, then we have a higher likelihood that you are going to keep your weight off and you're going to be more successful.